Well, good morning, everyone, and thank you to the organizing committee for this opportunity for us to present our work, where we're partnering with patients on grant reviews to strengthen practice-based research. There will be four of us presenting today on behalf of a much larger group, but before we do, I just want to acknowledge that we are coming to you from the ancestral unceded territories of the Coast Salish people, including spanning from Vancouver through New Westminster out into the Fraser Valley. So I want to start by introducing myself. My name is Lynn Feehan. I'm the Knowledge Translation Lead from the BC Support Unit, and my role for this presentation today is as the facilitator and timekeeper.
I'm Aggie Black. I'm coming to you from Providence Healthcare, where I'm the Director of Research and Knowledge Translation. And for this project, I'm the coordinator of our practice-based research initiative.
Hi, everyone. I'm Christy Coldwell. I am Senior Advisor for Research Advocacy at the Transplant Research Foundation of BC. I'm also a patient partner, and for this project, I served as one of the patient leads, helping to advance this important work.
Hi there, I'm Larry Mraz. I also work for the BC Support Unit, where I am Research Services Lead. And for this project and presentation, I helped develop with some of the data that we're going to present today. Thanks.
Great. Well, thank you, everyone, and looking forward to this opportunity to do this presentation with you. So over the next few minutes, we're going to introduce you to practice-based research and collaboration that we've put together of practice-based research programs. We're going to tell you a little bit about this project that we're conducting that's examining patient and family partner experiences as reviewers in practice-based research. We're going to spend a little bit more time just providing you with some of the key findings and recommendations arising from this work. And at the end, we'll just give you some ideas of how we plan to share this work with others beyond this conference. So to begin with, why don't I invite you, Aggie, to introduce us to what do we mean by practice-based research?
Okay. Practice-based research, I think of as research that's done at the point of care by and with clinicians who work at the point of care. It addresses questions that are relevant because they arise right from the clinicians working with patients. And because of the closeness to the practice area, findings from these projects often are more smoothly translated into clinical practice. Our researchers in our practice-based research challenge programs are mentored by experienced researchers, or I should say our clinicians are mentored by experienced researchers. The research programs sit within healthcare organizations who provide funding, training, and support for these projects, and the programs generally run annually.
Great, thank you, Aggie. So Larry, do you want to tell us a little bit more about this collaboration of practice-based research programs?
Sure, thanks, Lynn. So this collaboration consists of 5 different organizations who are running their own practice-based research programs. And these are all in different stages of development and all run independently. And they join forces with us, with the support unit, and with Transplant Research Foundation BC to form this collaboration so that we can integrate patient-oriented research into the programs and have some commonality in how we do that and share resources and that sort of thing. And just as a side note, we've been very successful in just this last year. 41 different projects were funded through these various programs and are now all in the process of conducting their studies. So we're very happy about that. Thanks.
Well, that's great. And thank you, Larry. So yes, very productive programs. Christy, can you tell me a little bit about what the role of the patient engagement research collaboration is, what we like to refer to as PERC?
Thanks, Lynn. Yes. So our PERC works alongside the larger collaboration, helping to both strengthen and to integrate patient-oriented research lens into the various programs. And we do this not only by supporting existing patient and family partners that are already involved, but also by assisting with training opportunities and building overall capacity. And so it is important to note that our PERC is composed of various individuals, all of which have really diverse lived experience with our healthcare system. And there's representation from all of the participating organizations.
Great, thank you, Christy. And as Larry mentioned, the whole focus of this collaboration is to sort of help work these programs into developing a patient-oriented approach. So Christy, maybe what do we mean by developing a patient-oriented approach?
Great, thanks, Lynn. So I think what's really important when we're thinking about this is to recognize that when it comes to practice-based research, there are many opportunities where patient and family partners can be involved, separate from simply being a team member on a research project. For example, they can be involved in advisory councils or governance committees, helping to inform decision-making as well as priority setting. And also, they can serve as a patient-family partner reviewer in the peer review panels where funding decisions are made. And this is actually going to be the focus of our session today. We're going to be exploring and delving a little bit more into the experiences of patients and family partners as reviewers.
Great, thank you, Christy. So, Aggie, I'm going to pass it on to you here and sort of say, why did we think there was the need for this particular project?
Well, we realized that many of us, including Providence, were working with patient-family partner reviewers on our practice-based research challenge proposals, but we weren't all doing it the same way. We weren't all providing the same level of training and support. So we thought it was time to step back and think about how we're doing this, what's working well, and how could we align this process across the organizations.
So from the program perspective, it was clear that there was some opportunities to sort of align the work. Christy, was this similar to what you were hearing from the patient family partner reviewers?
Yes, it was. It was very similar. A lot of the patient family reviewers were involved in more than one peer review across many different programs. And they were expressing some concerns around really the lack of continuity. They recognized that there were areas where there could be improvements made and there could be better coordination.
So thank you. So we launched this project, and Larry, what were we hoping to achieve?
Well, as Aggie and Christy pointed out, the people that were doing the reviews are a good source of information for how to do better. So really what we wanted to learn is how could we do this better? What worked, what didn't, how can we improve, and how can we inform future peer review processes across the organizations and beyond?
So that's great. Thank you. Christy, I'm going to move it to you and sort of have you launch us into how did we start this off?
Thank you, Lynn. So it was a really dynamic process that was patient-led, and it began by inviting 13 patient-family partners who had all participated in reviews in some capacity over the last 2 years. So of these 13 that were invited, all of them were really willing and quite eager, actually, to share their feedback and to be involved. And so we recognized that it was key to really create a safe environment where they felt they could be open, they could be honest, and really forthcoming about their experiences. And so to help guide these discussions in these groups, we developed a series of questions, all of which were really guided with the main goal of learning more about what the experience was like for each of them. And so during these groups, notes were taken, recordings were made, and transcripts were produced. And Larry, I'm hoping you can share more about what you actually did with these transcripts.
Absolutely. So as Chrissy said, we adopted a rather qualitative approach to this, and the general analysis was a thematic analysis approach. So basically, we went through these transcripts really carefully. We summarized what we found. We summarized what the main issues were that the patient partners suggested were important to them, and some of the recommendations. We grouped that together into themes and took that summary and sent it back to each of the participants in the focus in the discussion groups so that they could review it and to make sure that we were accurate in what we summarized and in the conclusions that we're making, and to make sure that we weren't missing anything. And then we took those findings, and Aggie's going to tell us what we did with them.
So we facilitated some working group meetings that had representatives both from people who coordinate the practice-based research programs and patient-family partner reviewers. And we looked at a summary of the conversations, the discussions, and tried to come up with some key messages and recommendations coming out of those. Christy, do you want to tell us a little bit more about how the working group worked?
For sure. So we had a really large body of information and material, and we all knew that we needed to narrow it down to something that was more manageable, something that we could better work with. And so after further discussions and deliberations as a working group, we recognized that of these 20 themes and the various highlights, that really they all represented and could fall within 4 main phases or stages related to the peer review process. process. And as you can see, these 4 stages were created, and of those 20 themes, they all fell into at least one or perhaps more of those 4 different phases.
Great. So thank you. So we're now at the stage where these working groups have done their great work and summarized some of the initial findings, key messages, and around these different stages and phases. So Christy, I'm going to bring it back to you and sort of have you talk about what were some of the key messages and recommendations that came around these sort of how do we recruit patient and family partners to be reviewers?
Maybe I'll take that one, Lynn.
Oh, sorry. Okay.
No worries.
Go ahead.
So as Christy pointed out, that we loosely group these recommendations based on the stage of the peer review process. The first stage is the recruitment stage. That is bringing patient partners into the review process itself. And we discovered that there was a lot of issues around preparedness for that. And one of the things that we found was that the partners said that having some previous experience in patient-oriented research was very helpful. Wasn't necessary, but it was extremely helpful. Another piece that came out of this was having a contact person right from the beginning. And as Christy pointed out, some of these recommendations go across all the different process stages of the peer review, but having someone that they can talk to right from the beginning that can help explain what they were getting into, because this is one of the things they didn't necessarily know what they were getting themselves involved in the first place. So having materials available for them, such as brochures or handbooks or something that described things like the timelines and time commitment and maybe a glossary of terms and commonly used acronyms. Frequently asked questions are definitely something that they wanted to have. So that started us off as how do we get people engaged in the first place?
Great. Thank you, Larry. So, okay, now this time I'm going to invite Aggie, and I think I've got it right, to provide some of the key messages and recommendations around once we've recruited patient and family partners, how do we, what's the process of how do we work with them?
So we realized that under the general theme of engagement, that our patient family partner reviewers needed to have adequate training and support. That training could come in a variety of formats, maybe a one-on-one, with the person from the organization, or maybe a webinar. People really wanted examples of proposals, like what would it look like if I'm reviewing a proposal that has fantastic examples of patient engagement in the research project. And then we also had a recommendation to put together some sort of mentorship program. We did this informally in some cases, but it wasn't formalized, and there wasn't a great definition of what a mentor-mentee relationship would look like. So there was also a recommendation that we formalize that and perhaps train the mentors.
Great, thank you. Okay, Christy, this is your turn. So, and it's we're going to let you talk about, what are some of the recommendations around the actual reviewing? How can we do that better?
Yeah, for sure. Thanks, Lynn. So when it came to the review phase, the recommendations were really grouped according or categorized according to really 2 main stages of the process. So one of those being really the first related to the review proposal, the proposal review stage, when patient family reviewers were actively looking at the applications, formulating their feedback. And while many of the programs did provide a template with which PFPs were able to populate with their feedback, their recommendations, it did become clear that additional support was needed to help them with this process and to help them understand how to interpret those templates, how to approach the applications, and what it was they were looking for. So something as simple as an additional sort of handbook that could serve as a resource to guide them in this work was viewed as necessary and needed. And really closely aligned to this was further clarity around the scoring or the rating system that was used. So this is both for patient family reviewers, while some programs did enlist or did use a scoring system, most did not. And this really just gave way to questions around how their feedback was weighted and how it had impacts on the funding decisions. But closely aligned with that was also more clarity around the scoring system for the scientific reviewers as well, because that created a lot of confusion for patient and family reviewers. And the second stage, or the second piece, was related to the review meeting itself. And the patient family partner reviewers, they wanted to feel like true members of that review panel. And in order for this to happen, it was recognized that everyone involved needed to have a really clear understanding of each other's roles and why they were involved in that meeting and why they were sitting there. So overarching everything was really to ensure that wherever possible, that there was consistency in this review process, as well as in the scoring system that was used.
Great. Thank you, Christy. And so, yeah, lots of fantastic recommendations. And so let's just go with the final recommendations around this issue of closing the loop. So, Christy, again, why don't you just maybe speak to, how can this feedback and clarity be transparency for the use of this be added? Sorry, mumbling.
Yeah. Exactly. No, it was really important to our patient family reviewers that they knew their feedback had an impact, that it was meaningful, and that their time and energy was well worth the investment. And so to this point was knowing how that feedback and their reviews were used and how they were communicated back to the applicants and ensuring that that was clear to them. That was really a key piece.
Great. Thank you. Aggie, do you have any final comments?
No, just closing the loop was really important, and Christy pretty much covered that. So.
And Larry, your thoughts?
Absolutely. The partners wanted to find out what was happening throughout the entire challenge. So they wanted to hear about the project. One other thing I'd like to mention is that it's really important to thank the partners for taking part in this and to offer them give them an offer of compensation for their time. And that's what I'll end with. Thanks.
Great. So thank you. So I'll just very quickly run through to say that is a work in progress, and we thank you for the opportunity to share our initial findings and recommendations. And we do have some future plans and ideas for how else we'd like to share this incredibly important information to not only inform future practice-based research, but maybe other opportunities as well. So I'll end with just a thank you, both to this great panel here for presenting, but more importantly to acknowledge that the work that we're presenting today really comes from a very much larger group of up to 30 people that have been involved in this process. And so again, thank you very much for this opportunity.